257.
Literature Library.
Thanks for staying with us. Today, once again, I am joined by our literature, statistical, and research expert, the extraordinary, the world-renowned Lit Crit. Hello, Lit Crit. How have you been?
Extraordinarily well, thank you. I must say, I had some trouble locating the studio today. It appears that you've changed the name of the show.
Yes, we have, Lit Crit. I apologize that you didn't get that message, but do you like the name Woundwire?
Absolutely. This was a wise decision.
Thank you.
Woundwire is a smart name. Very bold,
I think so.
Distinguishing, much more appropriate for this global educational program. Wound rounds is just so overused.
You're right.
Every hospital and every clinic in the country does wound rounds.
Well, you know, you're right, Lit Crit. You are, and I appreciate those comments. I certainly am glad that you approve of the new name. Moving right along in the Literature Library segment, we're going to go back into the archives of the literature, Lit Crit, to an article that was published in 1983.
I had to blow the dust off this one.
Yeah, I'm sure you did. However, despite the age of this work, the science has held true for the past several decades, and it still has significant clinical relevance in today's wound care practice. The article is entitled Irrigation Treatment of Leg Ulcers, and it was published in the most prestigious journal, The Lancet. In this article, Dr. Paul Svedman describes the clinical outcomes that were achieved with the implementation of a novel approach to the management of wounds. Translating the positive outcomes that were previously reported using irrigation in infected orthopedic wounds, Dr. Svedman engineered a technique for using continuous irrigation with normal saline in chronic wounds. A felt pad with an inflow and an outflow tubing was placed over the wound and then secured with polyethylene.
Quite the intelligent chap, that Dr. Svedman is.
Yes, indeed he is. This study reported the outcomes of 12 patients with 18 wounds, treated with either the Svedman irrigation method or our typical standard TID saline wet-to-dry dressings. Fibrin crusts were removed in all wounds treated with irrigation within 3 to 7 days, while none of the control wounds had complete removal of the fibrin crusts. Complete wound granulation was noted in all irrigation-treated wounds, but only 60% of the control wounds at 12 days. And no difference was noted in reepithelialization in either arm of the study.
The small sample size does not lend this paper to a statistical analysis, but the clinical trend is interesting.
Yeah, absolutely, Lit Crit. Yes, these positive findings have provided, clinical enthusiasm behind a variety of methods for accomplishing wound infusion and installation with negative pressure wound therapy. You are correct. Well, Lit Crit, thank you once again for joining me in presenting this landmark paper, and I will see you next month.
Innovative Therapies products are the result of Dr. Paul Svedman's 30 years of research and experience in negative pressure wound therapy. The Sved is software-driven with extraordinary functionality, yet it is simple to operate and enables clinicians to use negative pressure wound therapy as an effective wound healing tool. The Sved is FDA cleared for use with black and white foam. Black foam is hydrophobic and has very high tensile strength. It does not fray when it is cut, nor will it leave debris behind when removed from the wound. White foam is hydrophilic, but is soft and flexible even when dry. No need to increase pressures to move fluid through it. Innovative Therapies is the pioneer of simultaneous irrigation. This means that irrigant is constantly moving across the entire wound base, tunnels, and undermined areas without disruption in delivery of negative pressure. You don't need to have a separate dressing kit and no calculating fill volumes. 30 to 40 cc's per hour will cleanse even large wounds. The Sved is appropriate for use in all care settings.